Hi there. We are coming to you live from White Plains, New York, here in Westchester County, with our patient Tara here, who is going to share with you all about her back in the game story and what brought her to HSS. She will go through all of her story as it relates to some of the back problems she was going through and spinal related issues, and really share with you how she was able to overcome that and return to all of the activities in life that she enjoys. So if you have any questions during this broadcast, feel free to comment below. We will try to answer as many of them as we can. And as always, if you are looking to start or change treatment, speak with your physician before doing anything else. So let's get started. So Tara, first tell us who are you, where are we, and a little about yourself.
Absolutely, Andrew, and thank you for asking me to do this. I'm excited. If my story will help any of you, that will be a wonderful thing. I am a young 60-year-old woman. I like to think of myself as very active. I still work. I have an executive position with a company in the Westchester area. And I have experienced back pain for probably 15 years. And it was minor back pain, you know, those low back pain and twinges that you get when you work out. Because I've worked out most of my life, most of my adult life. And I play golf and I play tennis. So, you know, when you're doing all those things, you do begin to have some stress issues as a result. But over time, my back injuries and my back pain worsened. And so that's really what brought me here today and what has been a part of my journey.
So at what point over those last 15 years did you start feeling like the pain was transitioning from maybe light level pain to, all right, maybe I need to go see a doctor now, or just can you walk us through a little bit of that timeline?
Yeah, absolutely. Probably 5 years ago, 6 years ago, my minor back twinges became what's called radicular pain, which is basically radiating pain. And mine radiated down my right leg. So at that point, I felt that I probably had some nerve involvement, and I thought that it was something that couldn't necessarily be managed just with an aspirin at that stage. So I sought care. I was living in Pennsylvania at the time, and I sought care at a local teaching institution, academic medical center, with a spine surgeon at that medical center.
And what were the exact, can you go a little bit more detail into just the exact symptoms that you were feeling and really the level of pain? So if we're looking at things on a scale of 1 to 10, you know, were you able to roll out of bed in the morning and feel okay, or was this something affecting your daily life now at this point?
It was affecting my daily life. I couldn't roll. When I would get up in the morning, my pain was such that I would have to pause before I would walk across my bedroom. I lived in Pennsylvania at the time, but worked in New Jersey, so I commuted back and forth once a week. I had a townhouse in New Jersey that I lived in, and when I would finish the 3-hour drive to my office in New Jersey, I literally could not walk across the parking lot without substantial pain, and I felt like I was at least 15 years older than I was chronologically. The type of pain that I had was, as I said, it was radicular. So it basically was pain down my right leg. It was primarily a cramping sensation and pain in my thigh. I did have also numbness that extended down to my knee, so I could feel nothing on the right side of my leg down to my knee. I had pain in the bottom of my right foot and pain in 3 to 4 toes in my right foot.
So no more tennis, golf, working out. Did that just, you know, come to a complete end at that point, and you're looking, what do I do next?
I continued to do those things, with the exception of tennis, which I couldn't play. But I did continue to play golf. I did continue to walk, and I did continue to, when I say work out, it was really, I went from, you know, being able to do a full workout to really being able to only walk on the treadmill. And it just, despite all of the conservative things that I did, it just continued to worsen. So when I finally saw the spine surgeon at the other institution, he, as Dr. Level is, he was very conservative, and he said, let's try some conservative measures before. He said, you've got, you know, basically an old back. And I had degenerative issues, which means, where the back has disintegrated, for lack of a better word, at L3-4, L4-5, and L5-S1. And those are various levels in the lumbar spine. So I had 3 levels involved to at least some degree. Probably my worst level at that point was L4-5. So this spine surgeon recommended that I undertake a course of epidural injections where they inject the area around the spinal canal and the nerves around the spinal canal with an agent that is going to reduce the inflammation in that area. So I had a series of 3 injections, which actually worked, and they made me feel great. So I went through the next 18 months feeling really good. I could go back to pretty much normal with my life at that point, but then I started to experience the issues again. So I once again returned to this surgeon, and I went through 1 more epidural and a series of oral steroids. And once again, that gave me temporary relief. I probably had relief for about a 6-month period, and this time when my symptoms returned, they were even worse. I travel on a regular basis as a result of my job, and I literally twice was walking from gate to gate, actually hurrying from gate to gate, as those of you who travel know what that feels like, in the airport in Charlotte, and both times my toe caught and I fell flat on my face on a concrete floor. So I knew at that point that probably conservative measures were over. I was either going to break something and I was going to have a more serious problem, or I was going to have to address my back issue. And I don't recall if I mentioned this, but I did go through 4 episodes of 4 extended periods of physical therapy during this time as well. So I went back to see this surgeon, and this was in September of 2015. He repeated my radiographic study, so he did an MRI and took additional x-rays at the time, and for those of you who have back trouble, they take a series of x-rays, and some are flexion x-rays because they can see more on a flexion x-ray than they can necessarily a flat x-ray. So I had those done, and on flexion I had a significant degree of issue at L4-5 and L5-S1. And interestingly, which this specific doctor didn't diagnose, I also had an issue at L3-4. And actually, when I looked at the x-ray studies, my worst level was L3-4. And I had, according to the radiologist that read my x-rays, my damage at that level was severe, and that I also had not only the underlying bone issues, which I knew I had, but I also had a very damaged disc at that level. So I was in the process of moving to New York because I had changed jobs 2 years before, and I was commuting back and forth every week and living in a hotel in New York. So I had just bought a townhouse in New York, so I had a permanent base in New York. And when I saw those studies, I said, I live in New York, and I'm very lucky because the hospital that is world-renowned for orthopedic procedures is here. And I knew I, at that point, needed to seek a second opinion because...
And just to stop there just for a quick second, so how did you already know about the other hospitals or the other institutions that were available? Was HSS something that you had heard about prior, or had you just done research over these years that you're experiencing this pain?
I work in the medical field, and so I'd like to consider myself pretty conversant with major institutions, and of course I'd read about the work at HSS. I'd also I have a couple of friends that had procedures done at HSS, not spinal procedures, but had procedures done. And I know that HSS is also renowned for their ability to perform surgery and not have infectious processes occur after that surgery. That was important to me. And so I just felt that I could not get better care, and that was my own personal feeling, but that I couldn't get better care than what I would get at HSS. So I decided that I was going to seek a second opinion. I had I was new to New York, so I had no idea which physician to choose. And I had no idea how long it was going to take to get an appointment. So I started the process immediately. I looked at the HSS website. I looked at the various physicians that performed spinal surgery. They all looked wonderful. But frankly, Dr. Lebel's CV really made a mark on me and really jumped out at me. And I said, you know, I really want to try to see him. So I wasn't really sure what was entailed in that process, so I called his office directly, and I spoke with his office manager, who is wonderful. Her name is Giselle, and she asked me to send my radiology studies to Dr. Lebel, which I did. I received a call back within a week, and he agreed to see me immediately. I went to, and I got an appointment, literally, I think it was within 3 to 4 weeks. With Dr. Lebel, and I probably could have gotten in sooner, but that was dependent on my schedule. So I met with Dr. Lebel initially, and he felt that after he reviewed my studies, that I did have significant issue. However, he is very conservative as well, and he really basically talked to me, and he asked me what I wanted to achieve, and if I felt I wanted to move forward with additional conservative measures, working with the team at HSS, or if I was really ready to undertake spinal surgery. And I felt so completely comfortable with him that I was not only ready to move forward with spinal surgery, but I absolutely wanted him to perform that surgery. He and I talked about the various surgical options that I had, and we chose what was at that time the most conservative. I had a clear issue at L3-4. I had a clear issue with the disc at L3-4. So what we chose to do was to go into L3-4. He was going to insert a replacement disc at L3-4 and then fuse L3-4. He also believed that, in which we could see on the studies, that I had significant bone spur activity at L4-5. So he was going to go in at the same time and try to clean some of that bone spur activity up so that I didn't have significant nerve impingement or nerve involvement at that level.
I was going to actually ask, you know, what was the actual diagnosis that he came up with based on what he was saying?
Yes, it was L3-4. It was severe stenosis. With a bulging to ruptured disc. We couldn't really tell at that point.
And so at that point, he was recommending a spine fusion.
He was recommending a spine fusion at L3-4 plus what they call a laminotomy, which basically is removing portions of bone at L4-5. And with a disc insertion at the same time as the spinal fusion at L3-4. So that was this. And we did all this knowing that I had problems with the 2 levels below, so L4-5 and L5-S1, but a 3-level fusion is a major, major undertaking. And so, you know, he did not want to do a 3-level fusion at one time because of my level of activity and my want to get back to that level of activity. So we tried to do what was, he presented this to me as a staged approach, hoping that the fusion at L3-4 and disc insertion at L3-4 and laminotomy at L4-5 was really going to hold me for a number of years. And so I had that surgery in January of 16. I would not tell you that the first few days out of surgery were a walk in the park. I did have significant pain. I did have problems with mobility, but I will tell you that the staff at HSS is wonderful, and they do everything they can to help you to move right, to help you with pain medication, to get you through that period in the least painful and disruptive way that they can. And that certainly was true in my case. And
prior to the surgery itself, I mean, this is major surgery, obviously, so what was your, were you anxious? Were you nervous? Were you, was there a confidence level that you had? What were some of those discussions that, I mean, I'm sure you and your husband were having prior to the surgery taking place?
Absolutely. My husband was absolutely wonderful during this period and a tremendous support. And I was nervous. As I said, I have a medical background. I've worked in a level 1 trauma center, so I've pretty much seen a lot of things. Although I work in the pharmaceutical industry today. I don't work in medicine, but so even knowing what I know, you're still anxious because of someone's going to touch your spinal canal. So, however, I'll be honest with you, I got through a lot of that anxiety with Dr. Level. He was so wonderful, and I had such confidence in him. And when I met the morning of my surgery, when I met the staff at HSS, that honestly, the level of anxiety that I no longer had going into surgery. And I felt that I just really had no option, and that regardless, I was in the best place to have the surgery that I was going to have.
Now, before we continue with your story, Tara, looks like we have a question from one of the viewers.
So, Jonathan has a question for Tara. He wants to know what activities you were doing before the surgery.
I'm very active. I play golf, and I play golf was playing golf on a regular basis at that time. I'm not a good golfer, but I love the game. And I also work out. So I walk and run on a treadmill. I lift weights. I use an elliptical. I use a stationary bicycle. So I was doing those things, and my husband and I love to walk. So I was walking about 2 to 3 miles a day prior to my surgery. I also did take a course of yoga prior to my surgery because I wanted to try to be in the best shape that I could be for the surgery.
And for those of you who are just joining us, we're coming to you from Tara's home here in White Plains in Westchester. Again, if you have any questions, feel free to leave them below. And I didn't mention this earlier, but Tara actually submitted her story on our Back in the Game patient forum, which is home to over 1,700 stories similar to Tara's that talks about their experience with HSS and their recoveries. So definitely check that out at hss.edu/back in the game. So Tara, so you mentioned that you had the surgery. How long was the surgery? What was your stay like in the hospital?
The surgery itself was about 4 hours, I believe. At least that's what my husband tells me. I don't remember much of that. I do remember my waking up in the emergency or in the recovery room. And my stay in the hospital was planned to be 3 to 4 days. I had some drainage, which is typical for me. My body does this virtually after every surgery I've had. So out of an abundance of caution, until that drainage stopped, HSS and Dr. Level kept me in the hospital, so I actually was in for a period of 7 days.
And it looks like we have another question.
Cheryl wants to know what were your symptoms before the surgery? Just to recap again on what you were feeling before you had the surgery.
Absolutely. I had what's called radicular pain. That was my major problem. So my pain started in my lower back, which the pain there was minimal, but then it radiated into my right hip, down the outside of my right leg, I had cramping in my shin area, and it was down the right side of my leg all the way into my foot. And I had pain in, I can't recall if it was 3 or 4 of my toes, and I also had a burning pain on the both top and bottom of my foot. I did have numbness from my hip down to the level of my knee in my thigh as well.
So you mentioned how you spent a couple extra days in the hospital just out of caution and whatnot. So at that point, what did Dr. Level share with you in terms of what recovery now looked like post-surgery?
He felt that I would have a very good recovery. He was extremely pleased with the result of the surgery. They were pleased with my ability to ambulate in the hospital, walk around in the hospital. I had no problems with any of the physical therapy. It's not even exercise at that point, but you do have to walk up and down stairs, and you do have to be able to walk around the floor, and I could do all of those with ease. I had a wonderful nurse that was on evenings when I was in, and he came and made me walk every night, and he and I would walk for 15 minutes at least, and I think that really aided my recovery.
So in terms of, so you had the surgery and then you go through this rehab process. Can you talk a little bit about how often you were going through the rehab? How many hours were you spending at the sessions? What were the types of activities that they were having you do to help recover?
Absolutely. I did those basic physical therapy maneuvers, if you will, in the hospital. And then Dr. Level did not want me to start active physical therapy until after my first visit, and I believe that was at about the 6-week point. And after that, he prescribed physical therapy. I did go to a local facility in Westchester. It's a rehabilitation facility, and in concert with Dr. Level, they determined that I needed, or I would do best with about a 12-week course of physical therapy. So I went twice a week, as much as my travel schedule allowed, because I was back at work and traveling by that time. And so I did go twice a week, and basically during those sessions, and they were incredibly helpful, my physical therapist knew how active I was. So she worked with me on balance, on getting back, helping me be able to get back to the activity level that I wanted. And so we worked a lot on stretching, so that I'm not good at stretching as much as I work out. I just kind of dive in. So we went through, how to appropriately prepare yourself for exercise, because, as I was told, that's one of the best ways to prevent injury. So we worked a lot on that. My core strength was pretty good, but we continued to work on core. But we did, when you do balance exercises, you engage the core as well. So we worked a lot on balance. And she also was a golfer. And so she worked with me on the rotational moves that are required to play golf and play it without injury.
And how much during this process of the recovery is physical versus mental?
It's a lot mental. You have to have, if you don't have a positive attitude about this process, I would imagine it can be very challenging. You have to always look forward, and you have to think, yes, is it going to hurt a little bit if I do this now? Am I going to feel a little bit of muscle ache tomorrow because I'm trying to work out today? Yes, but you can't lose sight of your long-term goal. And so I tried not to look at the immediate. I tried to look at the future and saying this is all part and parcel of getting you back to where you want to be.
And we have another question.
Valerie wants to know if you had nerve conduction studies performed.
I did not.
Okay. She also wants to know what was the name of the surgeon that you worked with?
At HSS?
At HSS.
It's Dr. Darren Level.
So now we're sort of in the middle of 2016. You're on that road to recovery, and I understand you ended up having continued care with Dr. Level. Can you talk a little bit about that?
I did. I saw Dr. Level, I believe, at least twice more after my follow-up visit for this specific surgery. He was extremely pleased with my progress on each of those visits, and at the 6-month mark released me to basically go back to my normal activities. We had been staging that, but at 6 months I was clear. I no longer needed to see him, and I could basically do whatever I felt comfortable doing. And in my case, that was what was presented to me. If it hurts, don't do it. So we and that's what we both agreed to, and basically that's what I did.
Great. So now fast forward, and I guess we're a year since that time.
Mm-hmm.
How are you today?
Well, honestly, I felt fabulous after my first surgery. I was totally pain-free. I happened to be a klutz, and so one day I was going to work. I had to put some files in my car. I have a set of stairs that go down into my basement, which is finished, so the stairs are carpeted. And I walked out into the driveway to put the files in my car. It had been raining, so my feet got wet. I didn't realize it. I came back upstairs to grab my briefcase, and my foot hit the top of the stairs, and I fell all the way down the stairs. I kind of laughed about it, said thank God I didn't hurt my back because I felt fine. Mm-hmm. And yet, unfortunately, about a week after that, I started to experience back symptoms again. And I could not stand for longer than a 2-minute period. the pain got so bad in my legs. So I knew it was time to go back to Dr.
Right.
Level, which I did. And unfortunately, I did have some additional damage. So I had more surgery in a laminotomy and foraminectomy at L4-5 and L5-S1. So basically, that's cleaning out the disc matter and the bony spurs that I had told you that I had. We went in and did that once again to relieve pressure on the nerve. That surgery was incredibly easy. I was out of the hospital in 2 days. I had almost no pain, and I am totally pain-free today.
And that was 4 months ago or so?
That was yes, 4 months ago.
Great. And we have another question?
Another question from Cheryl about before the surgery. She asked, did you have epidurals before the surgery, and if so, did they help?
Yes, Cheryl, I had 7 epidurals over a course of about 4 years. I had a series of 3 initially, and those 3 helped. I got relief for about 18 months following those 3 injections, and I think I got the injections about 2 weeks to 3 weeks apart. And then I went through courses of physical therapy prior to my next epidurals. I had 3 additional epidurals after that point, which unfortunately I got very little relief from any of those 3.
Yeah. And that was from the previous institution before seeing Dr. Level?
That's correct, although I did have one subsequent with Dr. Level.
So you said you're pain-free, so what activities are you back to now?
I can play golf. I'm being a little bit more judicious this time. I'm not, I am waiting. I have set August as a goal for myself to get back on the golf course, as much as it's killing me. So I haven't played golf because that rotational movement I know is a significant factor with my back, but I fully intend to go back to playing golf in August. I am back to walking at least 3 to 4 miles a day. Dr. Level has cleared me to lift weights. There are specific ways that I can do that, so I'm back to working out and lifting weights in the gym. I use an elliptical, I use a stationary bicycle and a treadmill during my workouts, and I'm having no problem with those whatsoever. My husband and I just got back from a almost 3-week stint in Europe. We were on a cruise for 2 weeks, so we walked over uneven surfaces and up and down hills because we got off the ship every day and took tours, walking tours. And so I was walking up to 6-7 miles a day and had no problem and 0 pain.
Well, hopefully you'll get back to the golf course soon. I know for me, the golf course is the mini golf course. So just in the last minute or so that we have, any advice that you would share with others, or anything that maybe I didn't ask you that you want to let the audience know about?
Absolutely. You know, my advice would be, first of all, if you are suffering from back pain, radiating pain, then, please don't be afraid to see a physician. And a good spinal surgeon to address those issues. Secondly, if ultimately you need to have spinal surgery, honestly, I thought it was going to be some big horror, and it certainly is not. It's a very manageable process. Yes, some pain is involved, but it's controllable pain. And you feel so good after that, regardless of that short-term pain you may feel. To just get back to your normal activities and be able to live pain-free on a day-to-day basis is wonderful. So please just don't be afraid and try to approach it with a positive attitude that what you're doing today will stand you in good stead for tomorrow.
Well, Tara, thank you again for having us here in your home today.
Absolutely.
And again, if anyone has questions after the fact, whether it's for Tara or for Dr. Level, feel free to comment below, and we will try to answer these afterwards. So hopefully you all have a nice weekend. And again, if you want to read more about Tara's story or any other stories of patients who have visited with HSS, visit hss.edu/backinthegame. That is the world's largest forum of its kind with both orthopedic and rheumatological patient stories. So thanks again, and hope everyone has a great weekend.